Hi, it's your Pikin-doctor. So today, what I want us to discuss is sickle cell disease in children. So I know a lot of you must have heard about what sickle cell disease is all about. But today I'm here to throw more light and tell you about the do's and don'ts in case you have a child that has sickle cell, or you have a family relative that has sickle cell. So sickle cell disease, we all know, is a genetic condition and it's inherited. That means this child was born with it, got it from both parents. It's either the both parents are AS, or maybe SS, or one is SS and one is AS. So the child inherits both one S from the father and one S from the mother. So the child's genotype become XX. So when this occur, these children um, do present with a lot of symptoms. So, but I'll just mention the common ones that you can easily identify. So one of them is they have recurrent paleness of the body, what we call low blood level. So all the time you see their palms are pale, their eyes is so white, there is like they don't have blood in the body. When somebody is like looking like paper white, the person low blood, very weak, they are always weak, tired. Those are the symptoms of low blood. Another thing they can easily present with is recurrent bone pain. They're always telling you their hands is paining them, their leg is paining them, what part of the body is paining them, their back, their head, their neck. They have recurrent all these pains in the body. Another thing is that when they are below 1 year, they can have swelling of these their digits and the toes in between them can be swollen. We call it hand and foot swelling, and it's usually when they are below 1 year. Okay, so they can also have yellowness of the eyes. Their eyes like is yellow, that Lipton color, something like that. So they can also pass coal-colored urine. You see urine, the urine is looking dark. Those are the kind of things they can have. Also belly, their belly can be swollen because the organs there, the liver, the spleen, most times get enlarged. So these are the commonest symptoms that children with sickle cell disease present. There are a lot. They can easily fall ill, heart fever, infection. That's not what I'm here to bother you with. Do you understand? And I'm not also going to bother you what leads to all these symptoms. I'm here to tell you what you will do, in case you have a child that is sickle cell and they are having one or their two crises, or even when they are not having crisis, before you bring that child to the hospital to save a life. That's why I'm here, your Pikin-doctor. So one of the things you will do for this child, you know your child has sickle cell, or your child is having some of these symptoms I mentioned, please give that child a lot of water, plenty water. That child needs that water to reduce their crisis. They need to be hydrated almost all the time, so give that child plenty water. Now, when they come to the hospital, we place them on some medication they call routine drugs. you know Routine drugs, that's what we call them. There are a lot of medications that they need to be taking every day. Any mother that have a child that is sickle cell, or father that have it, know what I'm talking about. We call them routine drugs. So I'm not going to bother you with listing all of it. When you come to the hospital, we'll prescribe it for you. We call them routine drugs. That child has to be taking that routine drugs every day. That routine drugs will help build the blood, reduce the crisis, prevent some infections that these children are prone to. So another thing that you can do for that child, apart from giving the child routine drugs, is pain relief. You know that they are always in pain, so there are some pain relief that we recommend for them. So ensure that this child gets the pain relief when they are in pain, because their pain can be really really serious. So it's not a joke, my sister. If you see their pain, have you ever had a toothache before? That is how severe that pain can be, or earache. So the pain is not a joke. When you see them crying, they are not faking it. It is a serious emergency, so you have to ensure that they get pain relief at least while you're bringing them to the hospital. Give them something, paracetamol, ibuprofen, anyone you have available, but make sure that it's the appropriate dose that your doctors have recommended. So but ensure that you give the child something to be relieving the child while you're on your way to the hospital, or maybe in the middle of the night where you can't get a car to move the child in the hospital, you have this pain relief available. Please give the appropriate dose. That will help, calm the child a bit while you're coming to the hospital. You understand? You get the point now. So another thing is that you have to bring that child to the hospital. So it might be that you don't even know the genotype of this child. Please, if the child is having all those symptoms I listed, bring that child to the hospital to us so that we can take a proper history from you, tests, do some basic tests or routine tests for your child. And then if the child blood level is low, we know what to do. We can do blood transfusion or give some drug to build up the blood and correct all the other problems. Screen your child properly. These people, children that have sickle cell, they used to have a lot of complication. So the earlier we intervene, the more chances we prevent this complication or limit these complications. Okay, so things you should not do for a child that has sickle cell. My brother, my sister, listen very attentively as I'm talking to you now. Don't do these things. You will end up harming the child. You're not helping the child. The first ogbonge thing that you should not do for a child that is having that has sickle cell, having any of these symptoms I listed below. You see that thing they call agbafo that you people used to do. You will see a child with swollen abdomen. You take the child to herbal place. They will use razor blade that is unsterilized, start cutting the child's stomach. You say you're trying to reduce the belly size. You're harming that child. You predispose that child to a lot of infection like hepatitis, HIV, and then it will not still resolve the problem, because what is causing that stomach to swell is organs that are distended, the liver, the spleen. So that will not help your child. Another thing that will not help your child is herbal medicine. I have said this without time without number, that herbal medicine will cause your child kidney to pack up. So stop giving your child herbal medicine. It's not going to help your child. Bring your child to the hospital. Another thing that you will do is that don't take your child, the child that is complaining of bone pain, don't carry that child to bone setter and say let them set the bone, let them massage it. You end up causing infection, what we call osteomyelitis, bone infection, which these children are at risk of. Please, it is not a bone setter matter. Carry that child to the ward, to the hospital. At the hospital, we have a lot of tests that these children need to run. We have some drugs. We have many things we can do to help this your child. We even need to counsel you so that you will know about this condition, the implication. You will even know whether you should stop having children, so that you don't bring a lot of children that have sickle cell to this world to come and be suffering in pain. We will do genetic counseling for you. We have a lot of services we have for parents that have children with this condition. We might even refer you to the psychologist, to counsel you, because you benefit from it. So please, I always give you tips. So these tips, if you're paying for it will cost you a lot, but as your Pikin-doctor, I will always give you these tips to help you. So follow my page, like my videos, and share it to your friends and family, so that they will also benefit from these tips. So not only you. So I'll give you more updates to help your child, to help you, to help anybody. That is why I'm here. Thank you very much.